like that. And then please have your questions ready for Katie, and Katie will do the best we can with working in the chat box. And yeah, if somebody could be kind of my go-to in the chat box, if people are they come in late and they can't hear me, can somebody kind of take the lead on telling them where to go?
I'll help you with that, Jesse.
Okay, thank you. I just don't want to be distracted my whole time with looking into this chat box. So, okay, my name is Jesse Loader, and I am the Vice Chair of the Canadian Agent Advisory Council. And I just have to remember to record this, so 1 second. Board. There we go. Okay, so like I said, I'm the Vice Chair of the Canadian Agent Advisory Council, and this is the first year that we've had this council established, and we've been working on 3 main things over the past few months, and one of those is a mission statement, and the second is getting a benefits package for all agents, and the third is charities that we can all belong to from a company perspective. And so stay tuned for charity announcements. Those are coming soon as well. But today we're here to talk about the health benefit plan. So I'm going to roll through some of these slides here from the Silverberg Group to go over kind of some of the highlights of the plan. When you have questions, please literally just interrupt me or put them in the chat box, and if myself or Katie can answer, we certainly will do that. And so this was something that we did a lot of research on, a lot of due diligence on, and we ended up finding these guys, the Silverberg Group, and they provided what I think is an amazing program that is a good ratio of affordability with excellent value as well. So there's 3 different plan styles that we can choose from. There's a bronze, there's a silver, and there's a gold level package, which we'll get into more in a second. Everything that, no matter what package you decide to sign up for, there's no waiting period. So everything is immediate. And as you can see here, all pre-existing conditions are covered immediately for health and dental care. No medical information is required. And we also have the ability to apply for additional life and or critical illness coverage if you want to. It's not something that is required. Yes, this is going to be recorded. We're also doing another session on the 25th that will hopefully have less technical issues. So the benefits of this program, because we're doing this company-wide, we're able to, on a larger scale, we're able to lower the cost. It's a really comprehensive plan, and it's going to make sure that you're adequately protected in the event of an illness or anything like that. And so, like I said before, you can obtain this coverage without needing to provide evidence of good health. And it's really, really simple. We're going to have a link that we're going to send to everybody, and once you enroll in the program, it's going to be set up for a monthly pre-authorized debit for each participant. But it's also quite hands-off as far as an administration perspective for eXp, which was important as well, because we don't need to be bogged down with that kind of thing as well. Like I said, it is immediate coverage. It's coverage for everybody. We can also add our assistants to this plan, which is something we heard a lot of feedback on that was really important to people. Like I said, down here, you can add your assistant to the plan. They can have the same, or they can have a different level of coverage than the realtor. It's completely up to them. Now, this slide here, I mean, I don't want to go over, screw it up by kind of butchering this, but essentially we have life insurance included in this plan, and it's a flat fee of $50,000, which reduces 50% by the age of 65 and ceases at the age of 70. And there's also some value-added benefits there, as you can see below. If everybody asking, this is going to be recorded. This has already been shared, these slides, and it will be after as well. So don't worry, you're going to get all of these things. We're also working on getting some new media put out for everybody that's really nice and simple to read. And so don't worry about that. Everybody is going to be well versed in what this is. Chloe has a question. If my husband is 70, can I still add him to my policy? Katie could take that one because I don't know. Answering you now. Go. Dental benefits terminate at age 75. Okay, so moving along to kind of what the nuts and bolts of this, and what I think pretty much everybody is going to want to know. Everybody's mic is going crazy there. So hang tight with your questions, people, so we go through this. Okay, so the healthcare coverage level, as you can see, here's the three different packages: the bronze, the silver, and the gold. And the bronze, excuse me. So for prescription drugs, you can see it's either 80, 90, or 100% coverage, depending on which level you're at, with a $10,000 drug maximum insured per year. You can see 80, 90, or 100% healthcare co-insurance. Paramedical practitioners, so you either get $300, $400, or $500 per practitioner per year. So those are your massage therapists, your chiros, things like that. So depending on your level of the package you choose, that will depend on the price. Same thing with eye exams, are pretty much straight across the board, no matter what level. And then eyewear, you would get coverage if you choose the gold package at $150 every 2 years, and every year for children, which is great. And then termination, like Katie had already said here, ceases at the age of 75. For dental, you get 80% coverage for basic services. So those are your cleaning, your fillings, your root canals, your checkups, things like that. And you would get 100% coverage on the gold package. For major dental services, as you can see there, crowns, dentures, bridge work, there will be no coverage for the bronze level, but you would get 50% of that on the silver and the gold package. And the basic maximum is $1,000 per insured year. It'd be $1,500 for the other two on those package, and $2,000 of those combined services for the gold package. What was also really important from feedback that we received is getting some orthodontics coverage. We all know that's expensive, and as a father who is about to enter braces world with my children, this is something that's a nice little option. So it does cover 50% of your orthodontic services, up to $2,000 on the gold package. And recall exam, to be honest, I don't even know what that means. Maybe Katie can help answer that one, but I'm not sure. And same thing with the health benefits. The dental coverage also terminates at the age of 75. Katie's just typing something here, so we'll just wait a moment for that. Oh, recall your cleanings. Okay. Cleaning every 6 months on every level of package, which is great. Oh, don't worry about spelling and grammar in here. Paul has a question regarding paramedical services. For example, the gold package allocates $500 per year. Is that $500 per person under the... Oh, I see what you mean. So the $500... So actually, Katie, that's a kind of a question I had too. So is it $500 for chiro, and then $500 for whatever, physio or whatever else is covered, or is it $500 total? So Paul's after. Per person, per paramedical. Great, thank you. And just so everybody knows, the rollout date for this, this is not something we're going to have to wait a long time for. March 1st is the rollout date. So like I said, you are all going to be provided a link, and it's a very easy sign-up process directly through to the Silverberg Group. You can enroll March 1st, April 1st, or May 1st. After that, you're only going to be able to enroll every January 1st. Okay, now that's for existing eXp agents. I know everybody's going to ask the question, but we're, like for anybody that we're attracting to the company, so any new eXp agents can sign up when they join the company. Oh, here's another question there. Once we turn 75 or retire, would the silver group still cover us in a separate policy. So outside of eXp, is that what you're asking, Chloe?
Yes.
I'll let Katie take that. I have no idea. Carrie has another question. Are hearing aids / exams covered? Carrie, I will let Katie answer that as well because I do not know. So while they're doing that, I'll move on to pricing. Obviously, we all want to know the pricing. So this is the prices based on our location and whether or not you're going to do single coverage or family coverage. So, I mean, I don't need to run through this, but there's basically the bronze, the silver, and the gold, and then depending on what province you're in, those are going to be the costs.
Yeah.
And you know, I know for me personally, like I'm in Alberta, and for me to get a family plan, you know, the coverage was not nearly as good, and it was more expensive. It wasn't that much more expensive, but it was pretty close, but the coverage wasn't nearly as good. So I know for me personally, it this was by far the best value that we found for the dollar. I mean, in Alberta, on a gold package, $448 a month. Blue Cross was more money with less coverage. So, and, you know, just so you guys know, like I said, this was months of researching different companies, and actually Rachel Vanderveen was instrumental in getting this particular plan to the people, because we had almost gone ahead with something else, and this one was kind of dug up at the last minute, and we're certainly glad that it was, because it's definitely the best value around. And I see in the chat box here, original include dependents. We answered the hearing aid question. Are we tied into a 1-year agreement?
Jesse, I have a quick question.
Yes.
Now, my wife and myself are on the same team. And how does that work as far as our, we wouldn't do the family one. Can we still do it single? Because it'd be cheaper that way.
Like you would each get a single plan, is that what you're asking?
Yeah, because if I get one for her, one for me, it's cheaper than doing the family
Well,
plan.
no kidding.
We do that.
Read that yourself. Like you have to ask them the question.
I believe so. Katie can correct me if I'm wrong, but I don't see why you being married would prevent you from getting two single plans. But maybe Katie can correct me if I'm wrong there.
What he's saying, I think, is if his wife isn't a realtor, can she sign up?
Okay, somebody said they fixed the room so we can sit down.
Yeah, the control button.
It was what, sorry?
It's just a little bit button at the top.
Oh, no way. Was it that simple? Okay, I'm sorry. I've never seen that before, so I didn't know what the issue was there. So.
Me neither.
Thank you for fixing that, whoever fixed that. Okay, so we talked about the hearing aids. Katie answered that. A definition of a child is from live birth to under age 22 if they're unmarried and financially dependent
for a stillborn.
on the employee to support.
Total bullshit.
To age 25 if unmarried and a full-time student. Okay, a family is considered employee with a spouse, employee with children, employee with wife and children.
Huh?
Sit down.
Can you repeat the question, Katie? The question was husband and wife, both realtors with eXp. They don't need a family plan. Could they get individual single plans? Yes, you can. There you go.
Thank you.
This will be in Quebec as well. Yes, I know that Quebec wasn't on here, and that was just because at the time that we were provided this, those details weren't shored up. But as I understand, there is an option for Quebec. But I also understand that it you know, with the funky rules in Quebec for some things, it's difficult to make a group benefits plan worth it for residents of Quebec. But maybe Katie can answer that as well. Blake, I love the enthusiasm, but I'm sure we're doing breakdancing. Hey, look good though. Look good, Blake. Yeah, so maybe Katie can help answer the Quebec question and the French question specifically, because again, I don't fully know. So we'll just continue on with some. Oh, go ahead.
She's trying to talk. Thinking, maybe that.
Yeah, she is. Yeah, her mic is not working, but she is on the chat box there as Katie Chung. Okay, so moving on. So this is the optional coverage, so we all have the flat base fee of $50,000 of life insurance coverage. This would be optional life and accidental and serious illness coverage. So you can get it in units of $10,000 and $25,000 to employees and spouses to a maximum of $500,000 per individual. This is where you will need proof of good health, and this coverage would terminate at the age of 70 or retirement, whatever happens first. There's also critical illness coverage, so that's available in units of $5,000, the minimum of $10,000 to a maximum of $100,000 to employee and their spouses. So $50,000 guaranteed for employees if applied for within 31 days of the eligibility date. Case is March 1st. So child benefits, the maximum $10,000. And then, yeah, like I said, there's an application for coverage, just like the accident and serious illness coverage as well. So just to be really crystal clear, for the regular health and dental and life insurance, no medical questions, no proof of good health is required whatsoever. This is only for the optional coverage. Checking the chat boxes here. Yeah, okay, we got the French stuff answered. Okay. All right, now logistically, like how to use this. We all know it can be a pain in the butt to submit claims. This is going to make it really, really easy. So it's all going to be online through an e-profile. You know, we have pre-authorized debit for each person, so it just comes out of your account every single month. We don't need to worry about that. And when you're able to view the claims, you view the statements, your claims history. You're able to view the details of what's covered under the plan. If you forget something, you know, what dental or ortho or something like that, you can always go and check. You can print and download your claims forms. You get a personal ID card. And I mean, the best part about it is right on your phone, nice and convenient. I know just myself personally, I mean, I don't have benefits until my wife recently started going to grad school. So we get some benefits through a university, and they're pretty terrible. And it took me 4 months to get reimbursed for a simple chiropractor appointment. So that's not going to happen here. It's nice and easy and quick. For optional, okay, unit cost for optional cost. Yeah, so yeah, for the optional coverage that I just discussed previously, Katie said that get a pricing chart and send it to you if you're interested. So if that's something you're interested in, please maybe reach out on this chat box, and Katie can get you some of that information. Marco, can you upgrade or downgrade to other plans during the 1 year period? Katie, correct me if I'm wrong, but I believe you can only do it on every year, or if you have a life-changing event such as a divorce, a marriage, a child, something like that. That was in here somewhere, but I might have glanced over that. Here are Katie's information. So maybe you want to screenshot this or write this down if you have other questions to reach out to her. And that's the short and the long of it. I'm not the expert at this, so I probably butchered a lot of that. Katie was probably cringing as I was going through this. But like I said, it's the best we could do with some of our technology issues here today. But please ask questions. You can ask them verbally, and Katie can answer them in the chat box. That actually might be better. It will benefit kind of everybody. Plus, this is being recorded, so that might help.
Hi, Katie. It's Paul. I have a question regarding the family plan. If you have elderly parents or sibling that's living with you, that's not necessarily immediate family, that be considered part of the family plan?
I will put up Katie's contact info again here. Sorry, everybody. I'll go right to the end. Go. What is the app called? I don't know what the app will be called. And somebody asked, where do we sign up? I'm glad you're enthusiastic. That's fantastic. We're working on it right now. I'm working with some folks in eXp to get this. We're going to blast this out everywhere. So not only are we going to be making big announcements about this public as like a great initiative. Hey, look at what we're doing. But internally, we're going to be getting this all up to the agents through several different ways, mainly workplace. And we'll also be sending out a mass email to everybody. We're going to have the link in order for you to register, to enroll. And like I said, you can do that on March, April, or May 1st right now, just as we kind of ramp up here. And then after that, you'll only be able to do it every January 1st. And new agents can enroll when they join the company. And I know a common question I've also been asked is, hey, what can we send to, potential agents that are coming to the company? And I get that. I know that's a very important thing that you want to promote, but just hang tight. It's coming. We really wanted to focus on internally getting this going so that our current agents are on board and they know what they're doing before we really started pitching this to potential bracketers. So do we have any other questions? I believe your question was asked that taxes included in the pricing. I don't know, actually, Walter. It's a good question. They are not. Damn government, hey? All right.
Insurance is tax.
I think we got everything. If we didn't get any questions, please just shout it out or type it in if you got any more. But I'm excited about this. This is something that, like I said, a lot of work went into, and I think it's something that's really important. I know personally, I'm going to be signing up for it. So, yeah, I'm looking forward to it. Pricing, yes, it is in Canadian. Walter, I appreciate you saying thank you, but to be honest, I had a very small part in this. There was a lot of people on the CAAC that did a tremendous amount more work than I did. I'm just standing up here talking about it. Peter Fan and Dan Strickland and Serge and Katie Vanderveen found this one. Don Walton, Atish Chan. A lot of people put a lot of work into this, so it took a lot, and longer than we wanted to. We wanted to have it ready for the start of the new year, but and we almost did, quite frankly, until we found this better plan. So I'm glad that it actually took a little bit longer because we're all getting a better deal, better valued coverage as well. So does anybody else have any other questions? We're going to be doing another one of these, hopefully with less technical glitches, on the 25th as well.
Oh, hi, Jesse. Yes, I have one question.
Sure.
Can the dentist be paid directly from the provider?
Good question. Don't know. I believe Katie will answer here in a second. I think it's going to depend on the province too. I know in Alberta, a lot of them will do direct billing, but as I understand it, it's not so common elsewhere. So I don't know. Claims can be direct billed as long as the dentist has that system set up. Yeah, and that's some of the feedback we heard. I know in BC, it seems like that's not as common because it's kind of up to the individual dentists. But in Alberta, at least, it's quite common. Have them set up as well. Okay, great. It is common in BC. Okay, perfect. There we go. Typing here, so we'll just hang tight for a minute, make sure everybody gets their questions answered.